Okay, so hey guys, and welcome back. I'm actually really excited about this video. I've been wanting to make it for a while now. I am not a remote nurse, but I looked into it as I was kind of looking into applying to work as a remote nurse. You may just be tired of the, 3 12-hour shifts in the hospital and being busy and not really taking a break. I would notice, I made the video about it, right? Why nurses quit or why nurses get burnt out. This is a really good alternative to being in the hospital space physically, but still being a nurse. I'm like all over the place because my setup is a little weird. I'm sitting on my kitchen floor, okay? So if you see me kind of putting my arm on my couch. The first thing I'm gonna do is tell you guys about all of the different types of remote nursing jobs. I looked them up, so they're on my computer. I did a lot of research for this, okay? And their pay. The first one I want to talk about is case management nursing. So if you're going to be a case management nurse or telehealth, which telehealth is just basically health through like the computer, through the internet, you're going to be working with patients and implementing care plans and treatment plans and following up with them on their health care. And usually I feel like it's the geriatric population. You will connect patients to different resources that they may need. You can evaluate them, assess them, and then you can also educate them by like clarifying further their chronic illness or like treatment plans or dietary needs. RN case managers are working with nurses, other nurses, NPs, doctors, underneath doctors, social workers to provide care for the patient. These kind of remote nurses can also be like hybrid. You can work at home or in the hospital, but that's basically what that is. Salary.com, it said that it'd be between $91,710 and $110,557. Oh my gosh. I don't like saying numbers. I feel like The next remote nursing option is telehealth triage. So similar to like case management telehealth, but with this triaging kind of remote position, what you would be doing is you're going to be answering calls from patients where they'll have like maybe an emergency or maybe their blood sugar is too high, and you're going to triage them and tell them where to go, urgent care, the ED, a clinic, and basically you're determining what severity level that patient falls into and then telling them what next step to take. Typically with this kind of job, remote nursing, they're gonna want you to already have triaging experience. So maybe you worked in the ED or you worked for like some sort of clinic like Oak Street Health or Village MD that specializes in triaging patients and like selecting where they're going to go after seeing them. They also make appointments with primary care providers and keep documentations and records, which honestly all of these remote nursing positions do. They have to be pretty thorough with documentation and keeping records. The average salary in the US is $94,480, okay? But that's as of salary.com. By the way, guys, every single salary that I tell you, it depends, it varies. So it could change based off of experience, based off of your negotiating power during the interview, and I would say based off of location, but these are remote positions. So you should be able to work from anywhere in the US unless that specific position and that company wants you to be closer to home base or they require you to be in a certain place in the US. It depends. Every position is going to be different, but for the most part, this should be, what I'm going to be giving you is the salaries that I've looked up averaging in the US for these positions. So utilization management, you're going to be reviewing the patient files, be making sure that the patients don't get any kind of unnecessary treatments while in hospital or any duplicate services. You're avoiding any unnecessary procedures, any ineffective treatment, or like any unnecessarily extensive hospital stays. You're basically there to make sure that your patient is getting the most of the hospital resources and helping managing costs so they're not getting overcharged. Because healthcare in America is expensive, and that is a whole nother video for a whole nother day, but you know that. Salary.com, it was ranging from 64,000, it was raised, I think it's, you know what it is, I'm reading it, but I'm trying to like remember that I'm filming and talking to you guys, so I'm focused on you, I want you to focus on me, and I'm not thinking like, I don't know, I'm not seeing the number correctly, but it goes from $64,753 to $89,410. That is the typical range for this position, the salary. One that I found very interesting, a nurse writer or doing medical writing. So what you're doing is you can work with blogs or hospitals or nonprofit organizations to give information using your medical and clinical background knowledge to help them with a post or give them information or write something for them to post, and they pay you for it. A lot of people do this as like in a freelancing way. So I like the salaries that I was looking up for it, they kept changing. But then it is possible to make 6 figures per year doing this, because you're kind of managing yourself if you're a nurse writer or a nurse blogger, because if you're doing freelance, you can work as much as you want to work or as little as you want to work. So people do it part-time, people do it like here and there. Like I thought that was really interesting. Like medical journals, film studios, or academic papers, they'll work with them. So I like that, or even people do that for themselves if they want to talk about healthy sort of things or like nursing in general. That's pretty cool. So one to keep in mind that could easily be done part-time. Another work from home remote position is quality assurance nursing. You're evaluating nursing practices. I feel like this is less with the patients, more on the focus of the nurses and their resources, their like computer systems that they're working with. So basically you're going to be evaluating nursing practices to make sure that it's in compliance with the state and the laws and industry standards. So basically training nurses, improving patient care guidelines, or determining under or over utilization of different kind of healthcare services. So there's that. Their salary goes from $81,572 to $93,433 as of salary.com. I'm going to put it up on the screen, and I'm going to show you guys like different kind of salaries from the jobs that like I looked up, because there's all these different kinds of positions on Indeed or LinkedIn. So you want to look there as well to give you a different idea of different salaries. Another type of remote nursing that I thought was really interesting is legal consultant nurse. So these are the nurses who basically like use their clinical background and knowledge of the medical field and medications and like IV drips and flows and blood types and everything to use it in the court system. So they're the ones that like, when someone's on trial and there's some sort of medical issue and a lawyer's trying to represent the person on trial, the lawyer doesn't know about different kinds of medications and different times to give that medication, or like, the nuances of medicine, because they didn't go to medical school. They went to law school. So they have these nurses come in and give more information about like, the medical side of what happened during the case to help the side that they're on, which is so interesting. I did not know that this existed. I think they probably require a lot of years of experience and just you being very knowledgeable on your medical expertise, because it can make or break the case. But obviously they would consult with more than one nurse on a specific medical something or other. Basically translating healthcare jargon for attorneys, because it is a different language, but they need it in court. So ZipRecruiter says that this salary can range from $74,000 to $128,000, which is wild. But salary.com says it can range from $81,000 to $99,000. So it really varies. I think this is definitely heavily going to vary on experience and your medical expertise and your bargaining power. Position that I don't think is talked about a whole lot is nurse navigator, being a nurse navigator. So what nurse navigators do is they work with different kinds of chronic illnesses, they work with, the entire healthcare team, and they are working with different people with different types of diagnoses or chronic illnesses. From my own hospital, what I've noticed is there are nurse navigators specific to that diagnosis. So, for example, if somebody had a mastectomy done, there's a nurse navigator that we call the breast nurse navigator, or yes, that's what we call it. I'm thinking of the sign that we have over her name, and it says breast nurse navigator. And she will come in and speak with the patient after their procedure. Having like something major done to your body, like a mastectomy, it's huge, right? It's a big change. They come in and they bring like a bag full of support, like sort of items and goodies to give to the patient, educate them about how to care for their sites. Just as like we do the same thing, like if you're in PACU, post anesthesia care, but they educate them on their sites and how to care for their JP drains if they're going home with that, and they'll bring in like JP drain holders or things like that, just so that the patients know like what to do at home, or like a support pillow so they know to prop their arm up so they can reduce swelling on their arm. So I see the navigators in person, but I know they can also work from home. That salary.com, it can go from $89,000 to $111,000. Prior authorization nurse, or like basically insurance claims. So they work closely with the patients and the insurance companies to make sure that the patient gets the coverage that they need for the procedure, medical plan, treatment, or medications that they need. I was gonna go on and on, but that's the gist of it. They just use their critical thinking and nursing knowledge to help patients receive the proper coverage that they need. The salary for this, what I saw on ZipRecruiter, is that it goes from $70,000 to $100K. But like I say this all the time, that's gonna vary, you guys. The last one I wanted to bring up, which is a little bit different because you could only work in this field if you have your master's degree, but I thought it was really interesting because it's still like remote nursing and it's still very technical. Health informatics, okay? This requires a master's, but the average it's like $138,000, which is a lot of money, which is really good, obviously, but it's which makes sense for, it does require a master's. So basically, this is involved in the development of healthcare technology. You're working with healthcare systems, you're assessing and testing, helping with the design of different healthcare systems, educating other nurses on these healthcare systems, evaluating results and how they're used, what needs to be changed. There's so many different parts of healthcare informatics positions that I'm kind of trying to see if my phone is going to pop up and say low storage again. But anyway, a lot of these positions that I've been mentioning to you guys, I saw on Indeed. But what I'm noticing when I was looking for the different like remote nursing positions is a lot of the gems are on LinkedIn. So you want to create a LinkedIn account and then tailor your LinkedIn search to what you're looking for. The pay rate that you're looking for, the kind of company you want, the kind of position that you want, tailor it. Also, obviously the nursing positions that I'm listing here, this is not the limit of or the only amount of remote nursing positions there are. There are so many different positions. These are just the ones that I looked into that I have some kind of knowledge on, that I'm trying to give you information on. Camera cut off, so I'm back again on another day. You can kind of tell because my hair looks a little different. Curly hair, it never really looks exactly the same whenever you do it. Most of the remote jobs that I'm bringing up, or in general, are gonna require that you had at least 1 year of experience working as a bedside nurse. Because if you're gonna be doing assessments online for patients, just making sure we're still recording. You're gonna be doing assessments online for patients or evaluating patients online. They wanna know that you were able to do that in person, which is going to help with how you work with patients through the screen or working as far as documenting goes. You get like a LinkedIn profile and edit it and just make it look really presentable. And when you're applying to these jobs, like I always say, tailor your resume to that job. So whenever you're looking for a job, I keep saying the word obviously. When you're looking in for a job or looking at a specific job, it's going to write in the description of the job what they want and their requirements for that position. You want to make sure that your resume parallels what they're looking for, because even when you do submit your resume they're on their side, their computer is going to just look through the keywords that you listed just to see that you align with what their company is looking for that specific position as an employee. So you just want to make sure you have that listed in your resume. Just apply, apply, apply. You may get some no's because a lot of people want these remote positions, or you know, it might be a little competitive, especially the higher earning positions. You know, but just keep applying. Pros and the cons. Please know I'm a little biased because I really like the idea of working remotely. I do like the in-person parts of nursing, but I really do like the idea of working remotely. So first I'm gonna bring up what the cons are of working as a remote nurse. I'm not a remote nurse, like I've said before, but this is just what I've heard. People say that you can lose your clinical skills, and that's a con, but really, I feel like if you feel like you're losing your clinical skill. This nursing is a field where you can go back if you want. If you're missing the hospital setting and you worked at your remote job for a while, you can go back to the hospital setting. So if you're worried about losing your clinical skills, you can go back or work as a PRN nurse on the side if you do miss placing IVs or doing med passes. So there's that as well. But there also is, this is a con that I actually do think is a con. Having less social interaction. So if you're working remotely as a nurse, you're not working, you know, you're not providing direct patient care. I mean, you are in a way, but it's not that like in person, not as interactive, you know, physically or in person, or like providing that kind of hands-on care, literally hands-on. So maybe it's that. A lot of people, like even me, like, you know, their favorite part of nursing is the patients. So like that part may make you feel a little bit disconnected from nursing or the field. So there's that. But like I said, you can do PRN work on the side if you want to, or you can always go back to the bedside. There's also boredom and repetitiveness, which is another con that may come with that. So that's why people get those little, you know, treadmills that they put underneath their desk if they work from home, to get them some more movement so they're not just sitting all day. So there's that, and I understand that, but that's another con. Another con is if you are a remote nurse, most likely you're going to need like maybe a little work from home space, because you can't just work in like a coffee shop or a WeWork, because you're working with patients' private information, like, you know, HIPAA. So you can't really just, and you're probably going to be on calls with patients a lot, like maybe video chats or talking with providers or physicians about their patients. So you may not be able to be in like a coffee shop like space, like as I said. So there's that. So, you know, now that I talked about the cons, I'm going to discuss the pros. The biggest number one pro for like anyone who looks into remote work or remote nursing is the flexibility and work-life balance. So you get to work from home. You know, I call my friends and I'll be like, hey, like, are you at work still? They're like, oh no, I'm at Publix. What do you mean you're at Publix or at the gym when really you're supposed to be at work? Like, you know, there's a lot more flexibility. Apparently you can work from anywhere in the US as long as you have Wi-Fi, you have a position. Another pro is that there's no traffic or long commute time to get to work. That maybe save money on gas. Another big pro for a lot of nurses or maybe women who have kids is that you don't have to pay for childcare if you're going to be a remote nurse. You know, you'll be able to stay at home and work with your kids and watch your children, because daycare and like childcare is a whole nother expense, and that's just, it's too much. So I think that helps a lot of people out. Being able to do other things at home. You can work from home, and like while you're at work, you can be cooking or like watching your kids or like doing laundry. I feel like now you're able to use time in a way that you can't if you're at, you know, working in person at the hospital. And like I said, another pro is that if you do miss bedside nursing, or you figure out that remote work just isn't for you, you can always go back. You know, if you have your license, you have experience under your belt, you can always change your mind and go back to the bedside or go to outpatient or work at a doctor's office. There's so many possibilities with nursing. So it's like, if you don't like one thing, change to the other. So there's that. That's really all I have in this video for you guys. I hope it was informative and that you liked it. And, you know, if you had questions, I hope I answered most of them. I just wanted to give you guys this list because I was looking into it, and I like my position right now. Like right now, I work in PACU, like pre-op and phase 2 PACU. So I was looking into this, so I did a lot of research on it, and I had like a list of different positions, and I thought, you know, why not make a video about it? That's it. I hope you guys enjoyed this video. I hope you found it informative and that you liked it, and that like it answered some questions about remote nursing, or explained different types of remote nursing that you were looking into. Thank you for watching, as usual. All right. This thing is dying. Hold on, let me get some water. Oh, look at this.